Good morning. I'm good, thank you. Good dry.
Table good for you?
Table's good, thank you.
Okay, let's take our time out. This is Jake Andrews. He's here for Dr. O'Daniel to do a laparoscopic appendectomy. The abdomen is marked. The patient has no allergies. Are we ready to proceed?
Yes.
All right.
As the term malignant hyperthermia implies, elevated body temperature is central to MH. It is not, however, typically the first clinical manifestation. The most consistent indicator is an unexpected increase in end-tidal CO2, reaching as high as 2 to 3 times its normal level when minute ventilation remains constant. This increase may occur quickly or over a long period of time. Another specific sign is body rigidity, which can include masseter muscle spasm. Other common signs are tachycardia, hypertension, hypercardia, and PVCs. Later signs include severe hyperthermia, with core temperatures sometimes exceeding 44 degrees centigrade, and uncontrolled hypermetabolism. Skin temperature is not a reliable indicator of hypermetabolism. Instead, core temperature should be monitored.
Okay, we're getting finished up here. Let's get the trocars out.
Dr. O'Daniel, our temperature and our heart rate and end-tidal CO2 are up. I think we might be having an MH crisis.
All right, well, let me get closed up here real quick.
Diana, can you get Dr. Morrison here stat, please?
Meeting Dr. Morrison, OR3 stat. Thanks.
All right, well, I'm done. I'm going to go out and talk to the family and tell them what's going on. I'll be outside if you need me.
Okay, Dr. Morris is on his way.
All right, thank you.
Laura, what's going on?
Dr. Morris, I think we might be having an MH crisis. My heart rate's up to 160, my temperature's up to 40, and my end-tidal CO2 is 70.
Okay. John muscles do appear rigid. Have you given much narcotics?
I just redosed it, and I think he's adequate on that, but he still continues to climb on his CO2 and his heart rate.
Okay, I agree with you. I think we're in an MH crisis. Diana, will you go ahead and get the MH cart, additional OR personnel, and page Dr. Cotton back here stat?
We have an MH crisis in OR3. Can you page Dr. Cotton to come to OR3 stat? Can somebody bring me the MH cart, the crash cart, and send some extra personnel to help us out?
Laura, will you go ahead and start a peripheral IV?
Sure.
I'll get an A-line started.
Yes, and I've got the agent off, and I've got my oxygen up.
Okay. Will you go ahead and place a Foley? So long. Dr. Cotton, we're having an MH crisis. I need you to draw some labs. Better get this A-line in. I need you to draw a CBC, a BNP, a calcium, a CK, and coags, and go ahead and send a urine for urine myoglobin. I need you to get some ice and some chilled fluid so we can cool them down. All right, I need 2 people reconstituting Ravato. Based on his weight, I need 100 milligrams for 5 vials. To remind you again, I need 60 cc's of sterile water with each vial. Great, you got the ice. I need you to put some around his axilla, his head, his chest, and his abdomen and legs. And I need you to go ahead and start a bladder lavage with sterile saline. And I need you to put an NG in.
Okay.
Get these to the lab, stat.
First vial of Ravato is ready, 20 milligrams.
Great, let's get it injected. Dinah, can you go ahead and call the ICU and tell them we'll need a bed?
I'll call them. And here's the rest of the 5 vials, 20 milligrams each.
Sneak in here.
Somebody check my labs for me.
Sure.
Temperature, heart rate, and end-tidal are still elevated. Let's do an additional round of Ribonto. It's been 5 minutes.
Here is your second dose of Revonto.
Thanks.
Labs are back.
Great, let's see what we've got. As you would expect, the patient's in metabolic acidosis. The calcium's elevated. I'll try, let's go ahead and give him an AMPA bicarb, some insulin, and some D50.
Here's the bicarb and D50.
I've got your insulin.
Let's go ahead and give him 20 milligrams of Lasix to help protect the kidneys.
Do you have the D50? Let's take the